Dear student, today I am going to talk about ward radiography. As all of you know, ward radiography means where patient not able to shift it to the department of radiology. You will go to near to the patient, maybe coronary care unit, medical assessment unit, surgical unit, or cardiac surgery unit, ICU, high dependency unit, special care in the sense NICU, neonatal NICU baby. Maybe there are different places. You might go anywhere in the ward, in the hospital, and you will take a radiography. Sometimes emergency, sometimes in the casualty. That's all, which comes under the emergency radiography, uh, which is includes in the ward radiography. Usually when you take this radiography, usually patient will have a condition of unconscious, and patient in a treatment, certain emergency treatment, might be patient in a ventilation. So during those moment and all, you will take a radiography in the ward. So that's called ward radiography. So when you take a ward radiography, there are certain necessary steps you need to take. There are you take an example of when you go to radiography, what and all precautionary step should take by yourself. When you go there, the first of all, when you carry the cassette, you might be taking 2 or 3 X-ray at a time. You should have properly identified the cassette. When you bring it back to the department, properly you will put that cassette into the particular patient, and when you go there, you should use a precautionary step by yourself, avoiding any infection. Then another thing about the radiation protection by yourself and to the others, might be nursing staff, any staff, whoever residents accommodating in the ward. So what are the necessary steps during radiation protection you need to take? So when you visit to the ward, first of all, you have a responsibility of, when you taking radiography, nobody will be around the patient. Let them, any patients or anything, they should have a minimum distance to avoid unnecessary exposure to them, and clear verbal communication with the patient if it is patient able to understand, if it is conscious, and proper communication with the nursing staff. Those things should be done. One of the important factor which is explaining to the patient is very important. If unconscious, when patient is in ventilator, you cannot do anything, but if this patient is able to understand, not in unconscious, sometime post-operative, sometime suspected fracture, that moment when you take a radiography, you should properly explain. That's the most important part. At the same time, sometime if you needed someone to stand near to the patient, you can give a leaded apron to the patient party attender. That's the most important part. Or always by yourself use a inverse square law, where you try to keep a maximum distance from the portable radiography. You know, all of you, when you go to the portable, you might be seen there's an exposure button as a spring kind of cable. That's usually more than a 2 meter in is a standard in the as per the inversion as per the ARB law, Alara law. So you try to have a maximum distance from the patient exposure area to give a exposure to the patient. So use a proper lid, protective shield if it is necessary. If it is you going for taking radiography to the younger patient, it's always better to have a. And always another main important factor, exposure factor. So always have an exposure factor with the accurate method, because sometimes you have to see that where you fix the plug in portable radiography, in the mobile radiography, so where you fix the plug, it should be properly to the higher energy plug, not in the normal plug. So always should consider those all the part. So whichever radiography you are taking in the ward, that's a portable radiography, pardon me, is a mobile radiography. Portable radiography, it is not available in anywhere. This is all called mobile radiography. Mobile radiography is which is called heavy, where you should use the roller to move that, and you can take a bigger exposure in certain radiography. Portable radiography is which is foldable, fixable, where you can carry yourself to one place to another place. That's the portable radiography. So whichever using department is a mobile radiography. So what is the control of infection? That's already clearly in the beginning if I mentioned you. When you're taking a radiography, controlling of infection is very important. One factor is you avoiding the infection within you to the technologist, and another one, so from the patient to patient or from the technologist to technologist should be avoided. Now in a previous day you might be heard about H1N1 and cases and all, but nowadays everywhere we are behind with the corona. So when the corona patients you are handling, a lot of precautionary steps are there. PPE will be used, patient will be in isolation, those all a lot of things is there. Same time when you are taking a radiography in any patient, always should use a hand wash technique. You should be properly cleaned your hand before you touching to the patient, and after taking radiography, after that proper hand wash. Once you bring back that cassette, you should be cleaned well with any hypochlorite or any hand sanitizer or any liquid detergent. You should be cleaned well so that you can avoid the unnecessary exposure. This is what is written here in the control of infection. So as you can see, X-ray equipment, as I told you clearly, the portable relatively low EMA settings normally can be dismantled for transfer, but where in mobile radiography, which is using in the department at present, so that's for the higher exposure, all those things and all. So that is the components, how portable radiography works, how mobile radiography works. So that is already people might be studied in the physics part. So hand wash was what I was telling. You should use a proper when you enter to the certain ICU. You should use a proper glove, proper head cover, face mask. Nowadays, due to the corona and all, we use a PPE material. All those things should be properly utilized. As an assignment purpose, I wanted to write a assignment regarding on COVID guideline in the Department of Radiology. COVID guideline in the Department of Radiology in regarding to taking radiography in the isolation room or COVID suspected patient. There are certain steps and all should be taken. This is an assignment for you people. All of you should write that assignment and send it to me as as previously how you sent, same similar way in WhatsApp. Again, assignment question is COVID-19 preparedness or COVID-19 protocol to take a portable radiography in the isolation room in the hospital. That what and all precautionary steps should be taken. All those things you can visit to our website niti.edu.in. In that COVID protocol it is written. In that certain points in that guidelines and protocol for radiology 3-4 pages is written, so that you can refer that also, or you can refer through the Google. Lot of article is available. I wanted to know that how portable radiography should be taken when confirmed with the COVID-19 in the isolation ward. I wanted, that's the assignment for you people. Write it and send me before 11th. Write it and send me before 11th. Thank you.